Our next speaker is Mr. Esteban.
Picture a cupped hand and fill in the palm of your hand. Extend your hand towards your child, and you tell them, take your vitamins. This is my topic today, the over-medication of children. According to Generation RX, January 1st, 2010, about 7 million people abused prescription drugs in 2007. Of those 7 million, 2 million were from the ages of 12 to 17. First, we're gonna take a look and uncover the causes of the over-medication of children. Second, we're gonna look at some of the side effects medication can have on children. And finally, we're gonna take a look and see what type of solutions we can take to combat the over-medication of children. Children are being medicated nowadays can range anywhere from physical ailments to mental health disorders. Counselors, social workers, even psychiatrists are making decisions based on the Diagnostic Statistical Manual for Mental Health Disorders. This manual is essentially a book written for the consensus of leaders in their field. The most common type of disorder diagnosed in children today is ADHD. According to Selecting Effective Treatments, 2012, 4th edition, the rate of ADHD medication has increased fivefold since 1989. Some some diseases are even misdiagnosed due to that they share similar traits. Now that I talked a little bit about the solutions for the over-medication of children, or causes, let's take a look at some type of side effects medication can have on children. Medicating our children at an early age can lead to dependency and drug addiction as the children grow. According to medicating ADHD too much too soon, December 2001, the rate of ADHD medication was 2 to 3 times higher in 2 Virginia school districts than the national estimates for the disorder. Medication is even being used as a main street drug nowadays in schools, where students are selling their drugs or their medication for other drugs for money. Medication even has some types of side effects where it can leave you with insomnia, a loss of appetite, and even depression. And it can leave you with body discomfort such as abdominal pain, headaches, or dizziness. Now, Kara, who was a 12-year-old girl, was in the antidepressant Paxil for 7 months before she committed suicide. Her mother, Shannon, says that 3 weeks after being on the Paxil, she started a common attitude with everyone. She started fighting with everyone. Her grades started dropping. She didn't care what she looked like anymore. And she developed a severe rash all over her body. Sarah was found in her room with a bungee cord wrapped around her and a note stuck in her chest. Now, are these the type of discomforts we want our children to be feeling or dealing with on their own? No. Now that we talked a little bit about the side effects of medication, let's take a look at what type of solutions we can take to combat the over-medication of children. According to Nurturing Child's Well-Being, December 2011, parents can create an environment that nurtures a child's developmental needs, which creates a child's create the child's well-being. and nurture the child's well-being. We can also ask our physician several questions before agreeing to medication. We can ask them, what side effects does this medication have? Will this harm him in any way? And will he live a peaceful life without this medication? We all need to stand up for our kids who cannot stand up for themselves. Today we took a look at what type of causes, side effects, and solutions we could take to combat the over-medication of children. If we don't stop this epidemic from happening, then maybe one of our children will be dealing with some type of drug addiction. We all need to take a stand and only allow our children to take what's absolutely necessary and not treat medication as a vitamin.
Good job.